Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone's doing well today. My name is Meg Kennedy and I'm a communications program coordinator with the Havey Institute. I will be leading today's discussion along with Dr. Robert Murphy. Hi, Dr. Murphy.
Hello.
How are you doing today?
Doing quite well.
Well, that's excellent. You've got a new background, so it's a big day.
Yeah, it's a big day. I'm broadcasting from my living room now.
Ooh, big
Yeah.
reveal for those of us who Zoom with you often.
Yeah.
I'd like to welcome and introduce you, Dr. Murphy. Excuse me, and of course, Dr. Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. And Dr. Murphy will be answering your COVID questions each week on the Havey Institute for Global Health's Facebook page. So today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, May 5th. We would like to invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. I'm going to start with some updated COVID statistics for the US. So as of today, in the US, there are 12,601 average new cases per day of COVID, 4,198 average hospital admissions per day, approximately 150 COVID deaths per day, and 17% new booster proportion.
Well, well, that's really good news. We're continuing in this downward trajectory to about 150 deaths per day. This is an average, and it's getting very close or much closer to the average of the number of deaths per day from flu, which is 100 deaths per day. Flu is only occurs in approximately 6 months out of the year. So 6 months of the year, they have approximately 200 deaths per day, and the other 6 months, they don't have any or very few. So COVID, remember, is not seasonal. You can have outbreaks in August and whatever. But 150 deaths per day average is way down from what it was and definitely going in the right direction. The hospitals are not full of patients. They can handle the capacity. That's all good news. The sort of bad part of this is that of the new booster, which is really good, which came out in late August of 2022, only 17% of people have taken it. Now, this new booster really works good. So if you haven't had it, you should strongly consider taking it. And if you've already had it, you're eligible to take a second dose if it's at least 4 months from the first one. But what we're telling people is wait until the fall. Wait till the end of the summer and then get your second booster.
Right, thank you. And Dr. Murphy, while we're talking about the flu, when do you recommend getting the flu shot, your annual flu shot?
Well, yeah, and you can match up the your second new COVID shot with when the flu shots come out, which is typically in October.
Right. Okay, great. Thank you. Fall vaccinations and fall shots. So we have a question, and someone has been hearing about changes in travel restrictions. Could you please elaborate?
Yeah, so the travel restrictions are being relaxed further, and it's down to now, if the CDC has relaxed these a little bit more, if you've even had a single dose of the Pfizer or Moderna vaccine after August 16th, 2022, you can come in the country. So that's pretty relaxed. The other conditions still apply. But I mean, that's really a minimal thing. So people would only even have to have one shot to come in. So that's good. And it's just going into the direction. Ultimately, there will probably be no restrictions again. We'll see if these numbers keep going down.
Right. Okay. Thank you. And then I'd like to dive into some headlines. And we actually have a big headline as of this morning. So hot off the presses. So says my CNN app from my phone. The WHO says that COVID is no longer classified as a global health emergency. Could you, an expert, please tell me everything about what that means?
Yeah, so, the United States had planned to say that May 11th, the global health emergency would be formally ended. That ended up getting moved into April. Everybody knows this was going in that direction. The WHO didn't take that position until today. So they're basically doing the same thing that we've already done in the US and basically moving it from an emergency to disease of concern. So that's the level down from emergency. So it's the world, the WHO, World Health Organization, and the United States now are on the same page that this is no longer an emergency, but it's something of concern that should be looked at. The WHO also noted that, while this is of concern, there are still hotspots around the world where there are flare-ups of COVID. This has not gone away yet. So there are two big hotspots right now, one in Southeast Asia and the other one in the Eastern Mediterranean area. So they're going to keep an eye on that, and we're going to keep an eye on our cases, of course, in the United States as well. And hopefully this will all stay down.
Right. And now when news organizations referred or scientists refer to hotspots, what exactly, could you give us a quick 1-2 of
like
what that
a
means?
flare up of cases, like all of a sudden there's hardly any cases, and then there's a big jump up in cases. So that's a hotspot. So, more than expected, that's been going along. So you will see that. We see it with flu, we see it with other diseases as well, and we'll see it with COVID. If you go back to the 1918 flu pandemic, which was very deadly, they also had kind of three big waves. And then after the third wave, it ended up down in this low endemic state like we have today. So, this may be what's happening with COVID now. Let's hope.
Okay, let's hope. Moving on to the next headline. COVID-19 vaccination tied to increased risk of developing Bell's palsy.
Right.
What can you tell us about that?
So Bell's palsy is like inflammation of one of the nerves in the face, and you've probably seen it or heard of it, where somebody gets like a really droopy face with droopy eyelid and everything. It's very disfiguring. It usually gets better. Sometimes there's some residual from it, and they noted that after the vaccine, they were seeing cases of Bell's palsy. So it started to be looked at a little bit more closely, and many reports around the world have reported this neurologic finding, Bell's palsy, after the vaccination. So what the report you're referring to here is actually a meta-analysis. So it's taken all the studies that have been reporting Bell's palsy. And so there were 50 of them. 17 of them had some kind of mathematical quantitation, like, they had like, of these 10,000 patients, so many got Bell's palsy, rather than, oh, we have 3 Bell's palsy cases here, so they had a denominator. So those 17 studies were analyzed. It's like 143,000 patients. So that's a pretty big study. So the bottom line was that they showed that after the vaccine, there was an increased risk of having Bell's palsy compared to people that had not had the vaccine. However, if you look at COVID, there were more cases of Bell's palsy after COVID than after the vaccine or no vaccine, if you can track all that. So, so in other words, COVID causes increase in Bell's palsy can just happen, all right? So no one really knows exactly why, but Bell's palsy can happen after the vaccine, but it also can happen after COVID. And actually after COVID, it's even worse. So this is typical with all the neurologic complications that are being reported, that it's worse after COVID compared to the vaccine. But in some cases, the vaccine does trigger it. So why is this happening? Well, COVID vaccine kind of mimics that you had the infection. it presents part of the virus to you, the spike protein part, and you make an immunologic reaction against that. And that is the trigger. So it should be no surprise that the vaccine is associated with some of these neurologic side effects, but having COVID is actually worse than having the vaccine. So, I mean, that's kind of the story. Bell's palsy usually is, self-limited. It's pretty mild. It shouldn't be a reason not to take the vaccine. You always have to look at the risk-benefit ratio for the whole thing. And since Bell's palsy typically resolves by itself, you don't really have to worry about it. But they put some numbers on it.
I knew none of that, so that's very interesting for me. Thank you.
Yeah.
Wow, we're learning a lot today, Dr. Murphy. And then on to not that it's surprising, you're very smart and informed. And on to our next headline, which is about MS. So I'm seeing a headline, research suggests patients with MS on anti-CD20 therapy should receive additional doses of COVID-19 vaccine. Can you tell us a bit about that, please?
Yeah, so multiple sclerosis, another neurologic disease, sometimes is treated with this anti-CD20. And what they found, and this has also been shown in organ transplant patients and other immunocompromised patients, that the antibody response anyway to the vaccine is dampened. You don't get as robust response to the vaccine when you have one of these diseases and you're getting treated for it. And so what this study showed was that the response did improve if you gave more vaccine doses. So, we tell people to get the first 2 doses and then wait a while to get the booster, and every year probably get a booster. In this case, what they did is they measured the response. After the first 2 doses, they had a response of 51%. So that's much lower than in the general population. After 3 doses, it was 54%. And after 4 doses, it was 65%. That was just antibody response. And then they showed, though, that the T cell response, that longer response that keeps you out of the hospital and keeps you from severe disease, was very good, 92%, after just 2 doses. So what does all that mean? Some people who have underlying immunocompromised diseases with blunted initial responses to the vaccine do better if you give them a couple more doses. So this is a decision that is made by your practicing physician. The physicians that treat these patients, understand this. This data is now public. Other diseases that also are immunocompromised patients have shown the exact same thing. So it's no surprise that some people are going to need even more doses than the ones how it's regularly prescribed. So that should be no big surprise to anybody, but this is just more data that shows you can improve the response if you give a couple more doses in these kind of patients.
Great. Thank you so much. So Dr. Murphy, those are all the headlines I have for us today, but I want to thank you so much, as always, for your knowledge and your expertise. We appreciate it. The viewers appreciate it. And to all the viewers out there, if you have any questions, I have the luxury of getting to ask Dr. Murphy these questions as we record. So if you have any questions, please submit them on our Facebook page or our YouTube comments. I will happily reply to them in the comments and then bring them to Dr. Murphy. So thank you so much for another great episode, Dr. Murphy.
Great. Thanks, Meg.
Thanks so much, and have a wonderful day, everyone. And stay safe, stay vaccinated, stay healthy.